Well, good afternoon. As a province, we're making tremendous progress. And that's because of each of you. It's your sacrifices that have got us to the place today. Businesses are reopening, the number of hospitalizations and ICU admissions are declining, and most public health units across the province are reporting 5 cases or less. Yesterday, we processed over 30,000 tests, resulting in only 111 new cases. We haven't seen case numbers this low since the end of March. So I want to thank our frontline healthcare workers, the efforts of every Ontarian, and our brave men and women from the Canadian Armed Forces. Because of that commitment, dedication, and steady progress, our most vulnerable are safer and more people are headed back to work across the province. But no one has been immune from the impacts of this virus, whether it be financial, physical, or mental. The challenges we've faced have been unprecedented. But our seniors have been hit the hardest by this terrible virus. And that's why we acted quickly and decisively to protect them. It was a difficult but necessary decision to ask our seniors to self-isolate. But it was made to save lives. And I believe if we're able to save one life, someone's family member or friend, that was worth everything in the world. We know most of our seniors listened to the advice and stayed at home to protect themselves and protect their loved ones. This has been difficult on many, being deprived of seeing family and friends. As soon as public health trends started improving, we found a way to safely resume visits to our long-term care homes and retirement homes. We allowed households to create social circles of 10 so people could hug parents and grandparents again. We invested $11 million to help community organizations deliver food, medicine, and necessities to seniors in isolation and those with disabilities. And we partnered with Spark Ontario to help recruit over 6,500 volunteers to check in on our seniors and help those in need. Today, I am proud to announce an investment of an additional $4 million to further support organizations that are helping seniors in their communities. This funding will allow grassroots organizations to develop programs for seniors that focus on combating social isolation, promoting senior safety and well-being, improving financial security, and making communities age-friendly. We're providing this additional support because our seniors deserve nothing less than to live with dignity and respect that they have earned after a lifetime of contributions to their communities. As we gradually reopen the province and more of our seniors get out into the community again, please continue to follow public health advice, practice physical distancing, and wear face coverings when physically distancing is a challenge. Wash your hands frequently and stay home when ill. This is the best way to keep everyone safe. My friends, I will continue to do everything in my power. We will pull out all the stops. We'll leave nothing on the table when it comes to protecting our seniors and most vulnerable and the people of this province. Because we're talking about someone's parent, talking about someone's grandparent, someone who built this country and this province. That's worth more than anything in the entire world. And that's who I'm going to keep fighting for each and every day. Before I close, I want to give a big thanks to Vail Canada for donating 65,000 N95 masks to the front lines of the agriculture sector. Minister Hardeman, Minister of Agriculture, was a champion and helped secure donations to OMAFRA headquarters in Guelph. And now the masks are going out the door as we speak. It's great to see the Ontario spirit is still going strong. Thank you, and God bless the people of Ontario. I'll take questions now.
Okay, we'll go to the phone line for questions. First question.
First question comes from Ashley Legasic from News Talk 1010. Please go ahead.
Hi, Ashley.
Hi, Premier. How are you?
Fine. How are you? Good.
I'm good, thank you. My first question is about an outbreak at a Kingston nail salon. It's now led to 18 cases of COVID-19, and apparently over 500 people have been at the salon since it reopened. Does this give yourself or Minister Elliott any second thoughts or any pause regarding the current state of the reopening plan?
Well, it's concerning. It's ironic you asked the first question because the minister and I were just talking about it walking down here. And what it shows is the system's working. That's the first part. The system's working because how quickly we contacted and traced the 500 people. But it goes back to what we keep saying. You know, we have to always make sure that we wear face masks. We constantly wash our hands, and when possible, make sure in groups that we really stick to 10 people, the social circle. And I'll pass it over to the minister, and maybe she'll have a few comments.
Well, as the Premier indicated, we are able to do the tracing now, that we are able to follow, that we're able to make sure that we're in touch with anyone who was at the salon, who received services, that they now should be tested themselves, that they may need to go into self-isolation if they test positive. And but it does show that our system is working. It doesn't mean that we need to move back on anything that we've moved into stage 2, but we are continuing to follow it to make sure that the appropriate precautions are taken and that the appropriate follow-up happens, but it is.
Follow-up?
Thank you. And at this point, Premier, are you able to speak on whether stage 3 of the reopening plan will also have a regional approach, and when can we start seeing that?
Well, we actually had that discussion today on our cabinet meeting, and we're going to take a cautious approach, but we're going to rely on all the chief medical officers, all 34 of them across the province, and I'm sure that we'll be doing the same staged approach. And it's all about making sure we have good communications with all the chief medical officers, and Dr. Williams is doing that, and they're doing a great job. So again, I can't give you an exact time. Both the minister and I, we want to move this forward, but we're only going to move it forward based on the health and science and making sure that we're very cautious. You know, you look at the numbers yesterday, 30,000 tests. You know, as I say, they're running like a well-oiled machine, the testing side of things, and we haven't seen those numbers of 111 since March. So if we continue moving forward in a very cautious approach, we won't take that, well, we won't see the same events that are happening down south of the border in the U.S. right now. It's, if I'm not mistaken, the other day, they had 36,000 cases in the U.S. in one day. We had 300 cases in all of Canada. And even if I know they're 10 times the size, even if we multiply that 300 by 10, that's 3,000 versus 36,000. So I guess what I'm saying is that's the comparison, being cautious and everyone following the protocol, which they have, and I'm just so proud of the people of Ontario, versus a reckless approach, in my opinion, south of the border, that everyone just goes hog wild and don't worry about anything. Well, that's come back to bite them, and we just pray to God that doesn't happen up here.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, Colin.
Hi there. Good afternoon, Premier. I had a question about masks. As you know, Markham is now looking at making masks mandatory for indoor spaces. I know that your general recommendation is that people should wear masks, whether they're outdoors or indoors, especially if they can't maintain physical distancing. But there are a lot of people who live on the border of Markham, and we're starting to see these patchwork of policies, and people who might live in Toronto but shop in Markham might be caught somewhere in the middle. Premier, why not take that regional approach to masks and say everyone, as an example, in the GTA should be wearing masks?
They can do it now, actually, Colin. It's up to the chief medical officer. I've talked to Mayor Scarpitti about this, and the chief medical officer of York Region. That's their choice. If the chief medical officer of Toronto wants to implement that, they're welcome to under Section 22. They have a lot of power to change things. So if the community, the mayors, and everyone wants to do that, they're good luck to them. I don't disagree, by the way.
Thank you, Premier. But if you don't disagree with the idea of everyone wearing masks, why not just make it a provincial policy so that it's uniform across the entire province? You
just can't enforce it. You go up to the rural areas way up north, and there's no cases. As much as we can tell them to wear masks, they aren't wearing masks. Our MPPs are telling us up in rural areas they just aren't wearing masks. I encourage everyone, but we just can't enforce it. That's the problem here, Colin. But again, it's up to the local chief medical officer. If they want to do it, then God bless them. Well, all the power to them. I think it's a good thing when you're out in public, wear a mask, wear a face covering. And that's the reason we're at the numbers we are, because everyone's listening.
Next question.
Next question comes from Matt Simard from Radio Canada. Please go ahead.
Come on.
Oh, hi, Premier. My question is for you. The Canadian Armed Forces are leaving long-term care homes, except you've asked for an extension at Woodbridge Vista Care Community. Can you give us the reason why you still need the military there, and are you confident that the situation will get better in just 1 week?
Well, I want to thank the Canadian military. They're absolute champions. They've done an incredible job, and they aren't leaving until all the houses, the long-term care homes, I should say, are in the green level, and make sure that it's a secured environment for the people in long-term care. And that's why we asked the military to stay one week longer in Woodbridge. But the other homes are in green. They're doing better, but we have to be vigilant on this. We have to constantly watch us.
Follow up.
And do you have a plan to deal with the staffing shortage at long-term care homes now that the military are leaving? And could you ask the Red Cross for help, like in Quebec?
I do. I'll pass this to the Minister of Health. Thank you.
Well, what we're finding is many of the staff members of long-term care homes who left when the homes were in outbreak, now that the homes are stabilized, that they're following proper infection prevention and control procedures, that they have the necessary PPE in order to do their work. We're finding that many of those staff members are coming back. So while they might not be at the pre-COVID levels yet, they are coming back, and we are still in the process of bringing more people on board, training them. We want to make sure that they will stay there, but that's going to be necessary and dependent to a large degree on making sure that the public health precautions are being followed. So we are going to be following up to make sure that happens with the inspections and so on that are continuing by the Ministry of Long-Term Care. That's a very important factor in keeping staff in place.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hi, Cynthia.
Hi, Minister. While you're up there, I guess I'll ask my first question for Minister Elliott. Oh, I'm sorry, now you've moved. It's a few seconds behind. So hello, Premier. I know the verdict is not in yet. The judge is still reading it out in the trial of an off-duty police officer and his brother assaulting a young black man, DeFonte Miller, who lost an eye. This is another example of what many people are calling systemic racism in policing. Could you address this and what needs to be done to eliminate this kind of serious concern that this is an ongoing problem with police and the black community in particular?
Well, let's first of all, let's see what the judge's decision is, because I can't comment since it's in front of the courts. But I understand, Cynthia, there's so much pain out there in the communities right now, and I've heard from so many people in the past few weeks, and I know there's so much work to be done, and I'm committed to do that work to make sure that we end any systemic racism anywhere in this province. So I'm going to make sure that we continue on the path of we're working with communities, and we have to work with police to make sure they have the proper training, and there's a whole bunch of tools that we're going to be using to make sure that we work with all different groups here.
Follow up.
Well, Premier, can you give me some specifics on how you plan to eradicate systemic racism in policing, and do you acknowledge that there is systemic racism in policing?
Well, I've said it probably a dozen times. Yes, there is. And secondly, that's why we brought on Jamil, as all of you met before, and working with the communities, and not just the black community, all communities that feel that there's been racism towards their community. And we're a great country, a great province, and our strongest strength and the number one selling feature that when I go out and around North America to attract businesses, I always say the diversification. The vast majority of us, Cynthia, we all live together, no matter race, color, creed, and a vast majority, all work in the same environments, live in the same neighborhoods. We can work together and resolve this. It's not going to be easy, but if we work together and everyone listens, we're going to get through this together. And that's the only way we can resolve this.
Next question.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Hi, Robert.
Hi, Premier. Monday marks the second anniversary of your swearing in as Premier, and you're also kind of halfway there. The next election is 2 years away. I'm just wondering, the polls suggest that you are in a lot better political shape now than you were 1 year ago. How are you feeling as you look forward to the next 2 years? I know we're in the middle of this pandemic, but do you feel that you kind of have your feet underneath you now, and you have the hang of governing, for the lack of a better term?
Yeah, you know, Robert, I look back, and I always look, and anyone who says they don't make mistakes or bumps in the road would be lying to you. There's always areas to grow into the position. I think our government has as a whole. We did a lot of tough decisions in the first year, but I look back at the 21 pieces of legislation in the 131 days we sat, put us in a better financial spot. But my main focus right now, Robert, is number one is COVID and the health and well-being of the people of Ontario. And right beside the health, because health is number one priority, but almost right beside it is getting the economy going and putting money back into people's pockets and really get the economy thriving like we did before. It's going to be a challenge, but we'll get there because everyone has pitched in. I can't tell you how proud I am of the people of Ontario and the companies that have all stepped up. It's just an incredible feeling that we're all pulling in the same direction. And when we all pull in the same direction, we're unstoppable as a province. And we have some great announcements coming forward about the economy too. As simple as let's buy local, let's buy made in Canada. Let's start, taking care of each other and looking out for each other like we have been for the last, I guess, over 100 days.
Follow up.
Now looking ahead, the next election is scheduled for June 2022, but it doesn't have to be held then. It could be held a year later if Ontario is in an emergency, and it's been in a state of emergency certainly since March and will be till at least July 15th. Is it too early to think about whether you should delay the 2022 election until 2023?
No, that's too far ahead. I'm looking day to day, week to week, and where we're going to be at 6 months down the road and get the economy going and get people back on their feet. Really hasn't crossed my mind. I just want to take care of the job at task right now and keep working hard. And everyone's working hard. There's so many challenges out there right now, financial challenges with people, and they're really hurting. That really weighs on you, and making sure we create the environment for companies to thrive and people to be re-employed again. That's my main concern right now.
Okay, this will be last question.
Last question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. I wanted to ask about Prime Minister Trudeau's comments today. He said the First Minister's declaration condemning racism didn't mention systemic racism or systemic discrimination because not all the premiers would agree. Can I get your comments on that? Did you agree with that term, and which premiers didn't?
Well, first of all, I agree. There is systemic racism. I never spoke on that item yesterday. I spoke on another item, but really, I didn't think it was a big conversation yesterday. It might have been a week ago. And I guess the biggest concern about the letter with all the premiers is a letter is one thing. We all acknowledge it, and I think we've all acknowledged it in our own provinces. And 3 to 4 weeks later, we're putting this letter out. We want action. And I know the Prime Minister wants action too, but all the premiers are saying enough of the talking. Let's start getting action, get things in place and start moving forward. And that's where we were at. But the letter went out, I think we all agree. As a matter of fact, I know we all agree. Every premier and the prime minister all agrees there's an issue. We have to deal with it. But talk is cheap, and let's see some action.
Follow-up?
And you alluded to this yesterday, but I wanted to get some specific comments on you. You mentioned an article in the Toronto Sun, which says that your government twice rejected funding for long-term care, including in February, to stabilize staffing levels. Can you clarify whether this occurred, if this is some sort of internal dispute that's happening among members of your government?
I'm sorry to interrupt, but that is so frustrating that the person, I like the person that wrote it, I'm not going to name the person, I really like the person, but they didn't do their homework. It's just the furthest thing, riddled with mistakes, furthest thing from the truth. We put in $243 million, and the working group, I want to get this done until they can come back and ask for more money. It just totally was totally inaccurate, not even close. I don't even know where they came up with the stories, but just do the homework. That's all I'm asking, or even better, because the media's been doing a great job, by the way. I got to compliment them. They're doing a great job, but just call the office and we'll give you the straight goods. Call Ivana, which most of you have a great relationship with Ivana. Call her up. We'll give you the straight goods. There's nothing to hide here. We're pouring money into long-term care. We're going to pour $1.75 billion into long-term care, making sure that we have more rooms. We're going to throw everything we have at it. So no one's ever invested $1.75 billion. To give you a comparison, the last administration that was down here in 15 years created 611 beds. There's a backlog of 30,000. We want to create 15,000 the first 5 years. And I know there's been a little hiccup here over the last few months because of COVID, but we're going to really start driving new homes, long-term care homes, an expediting process, and working with the municipalities to expedite the building permits. And we're going to do a little experiment in a couple months that I'm going to work with the municipalities, 3 different municipalities, on how quickly we can actually build long-term care homes. There are about 300 and some odd beds in each home, but we're all work together. We work with labor, we work with the municipalities in the province, and work with the feds. We're going to expedite these homes. But
Okay, thank you.
that's it. Thank you so much, everyone. Have a fantastic weekend. Stay safe and just practice the protocols. Thank you.